So our next section is common orders on CCU. So how your consult services are different from your wards team is that you don't always place orders for these patients. So for example, if your patient that you received a consult from is from a UCSF medicine team, so that means either one of the internal medicine teams where our colleagues are working, or a family medicine team, or an ICU team, or any other residency for that matter, you tell that team what our recommendations are after rounds, and you ask them if they want us to place orders or if they're okay with us placing orders before you place orders. For hospitalist team patients, that means they're not on academic teams. You place all the orders for those patients. One thing to remember when you're placing orders, especially for cardiac medications, is holding parameters. So what do I mean by holding parameters? So for example, if you're giving someone a beta blocker, like metoprolol, and when you're evaluating the patient, their heart rate is in the 90s, so you feel like it's safe. But by the time the nurse is giving the patient the med, their heart rate for some reason has now dropped into the 50s. If you don't put in your order that hold this medication if the heart rate is less than so-and-so, or if blood pressure is less than so-and-so, the nurse will always give the medication. So you want to put in a holding parameter, and how you do that is when you go to orders and you're typing in order. Let's see if it lets me. So you say you're ordering metoprolol. You have to click into the medication and add admin instructions. And then here you say hold if heart rate less than 60, blood pressure less than 90 over 60. And you kind of have to decide those parameters. Most often, heart rate less than 60 or blood pressure less than 90 over 60 for the CCU service should be fine. But obviously, it will vary patient to patient. So just use your best clinical judgment. So that's what holding parameters is. And then we'll go back to, for imaging orders, you want to select read by UCSF academic MD. So when we order, for example, an echo, you want to, so there are two, there's a limited study and there's a transthoracic echo, and then there's image enhancer. So you want to make sure you know which one you want to order, and you can always ask your fellow which one's appropriate for your patient. More often than not, it's just the echo, echo, or the image enhancer echo. So you transthoracic, you say what the reason for your consult is. And then here, when it says interpreting physician, there are a lot of physician names on here, and you want to choose UCSF academic MD, and then hit accept, and then you can sign the order. All right. Next section. So now we'll talk about notes. So for new patients, that's new consults, you're going to do a consult note, and I'll show you the template now. And for follow-up patients, you're going to do a progress note, and I'll show you what a copy forward function is. And for all of your notes in CCU, because it is a busy service, keep the assessment and plan or the recommendations short and sweet, right? You don't want to be spending a lot of time on your notes, but at the same time, you want to make sure that whoever's reading your notes knows what you want to be done for your patient. So when we talk about notes, so go here to create a new note, and then this will populate because you are in the cardiology space already. So when you type in a note for a new consult, you're going to type in consult note here, and then it will auto-populate for you, okay? So, so the note auto-populates for you a template for a consult note. So whenever you have a consult here, you just have to click the associated consult, and then that will mean that you've addressed the consult that was placed by someone else. When you go through your note, this is kind of the way that the note is structured. So you'll type in your HPI, if there's any ED information, exercise tolerance, cardiac history and risk factors, cardiac home medications like we talked about, past medical history and family history if there was anything relevant, and then your vital signs, labs, and then here is where you can cut and paste your echo impression, your chest x-ray findings if they are relevant. If there's a heart cath, you can paste the impression here along with the dates, because oftentimes patients will have multiple. So it's helpful in the consult note to have all of your information cut, copy, pasted. So this was your new patient consult note. So we will get rid of this. And then if you're writing a progress note for the first time, you're going to hit progress note and you're going to do the same thing. So you can pull most of this information from your consult note, but usually the first time you do a progress note, you're going to have to kind of fill this in yourself, just because it doesn't copy forward from a consult note. But after your first progress note, if you sign it, for example, let's see, it's going to delete everything. So if you sign this note, and the next day when you come in and you need to write another progress note on this patient, progress note, and then you don't have to refill all your information again. This is where a copy forward function comes in. So this little tool right here, you hit copy forward, and then this, you remove encounter filters, and the note that you have signed under the cardiology context will show up. So this is the one that we signed just now. So then you click accept, and then it copy forwards all of that information. And the interesting thing about this tool is that all of those labs or anything that was pulled into the note will update for the next day. So you don't have to update those things. So that makes it convenient. And then you just sign that note for your next day with your updated information.